Welcome back to Let's Just Do This. I'm Todd Miller, along with Margaret Wallis-Duffy, my effervescent and bubbly, knowledgeable co-host.
Well, thank you, Todd.
I try.
And you know, it's
Turning
kind
the
of nice
tables.
being hanging out beside you. I'm always interested in seeing what gorgeous shirt you got going there. And
Yeah, I got a closet, a bit of a clothes horse.
yes.
Yeah.
Well, you know, today we are going to have a discussion about something very, very important and near and dear to both of our hearts, and that is mental health. Now, this is a very big topic and one that we need not take lightly, but it's also a topic that I am absolutely passionate about and determined, which is why we're doing it here on Let's Just Do This, that we take a more integrative and real approach to this topic. We don't have all the answers, and we don't claim that we will have those today, but we are going to get real about a more integrative approach, and one where we're going to be able to strip away, I think, some of the stigma associated with a very difficult topic. Now, I know, Todd, this is dear to your heart as well because it's touched your family.
Many times I have extensive exposure with people I know that suffer from depression and bipolar. I myself suffer from PTSD, so I struggle with that every once in a while.
Yes, and you know what? There is so much to talk about, and so we can't do it justice in just one show, but we're going to start here today. And what better person to do that with than one of our colleagues and good friends to our show, Dr. Hilary Webster, who's a naturopathic doctor. But you know what? She's more than that. She's a real human being that's willing to share real stories and to also link arms with all kinds of other healthcare professionals so we can be better together. Dr. Webster, welcome.
Thank you very much for having me once again.
So when I asked you whether you'd come on and, you know, start to have a real soulful discussion about mental health, you immediately jumped at it. Why?
I don't know someone who hasn't been affected in some way by mental health concerns. I've been affected by them at certain times in my life. I hold my patients' hands through moments of profound grief, where they're experiencing mental health challenges because they're losing a loved one or they're working through a process. I've actually, when I was an intern and working at the Brampton Hospital, I saw an inpatient for schizophrenia, and we tried to work integratively within the system, which was brilliant. So it's also very topical right now. There are a lot of people publicly who are losing their lives, and I think it's really needless. It's absolutely tragic, and we need to take this seriously, and there's not enough action. The system, when it's so siloed as it is insufficient, and I really applaud your efforts, Margaret, to help to change the world in the way we see healthcare and to help to change it at a public policy level, because I think it's got to be top down and it's got to be bottom up, and we can do our part as individual practitioners, as family members, as loved ones, as patients, but we also need to be talking to the change makers and being change makers ourselves.
Oh, and you know what? Thank you for recognizing that, because there are times, and I'm the first to admit it, that when you have a big goal and this Better Together mission that I'm not on alone. I mean, we're all part of this, as along with so many other healthcare professionals, but stakeholders, government, insurance companies, hospitals, municipalities. It can be tiring and frustrating because you feel like you're spinning your wheels. But what I do know to be true, and I'm going to try not to get tearful, because there's people in my own world that I've watched suffer so terribly and that are still suffering. And as you said, people that are losing their lives. And there's a lot of coverage on the popular people that lose their lives. And I don't mean this with any disrespect, but the Anthony Bourdains and the Robin Williams and the Kate Spades of the world. But there's a Kate Spade and an Anthony Bourdain in each and every one of our family members. And without rolling up our sleeves and being willing to have these difficult conversations and to not just work together, but to peel back the layers and really put ego aside so that we can work together and be better together, this crisis is only going to get worse. And this bandage approach of just numbing society, you know, and I'm not against pharmacology. We've had amazing pharmacists on this very show, Miranda Toffick and her sister Sherry, who own Origins Pharmacies. They're one of the best pharmacists I know, and there is a time and a place for medications, which we're going to talk about in today's show. But there's place for everything. So let's start this discussion with your passionate approach to integrate healthcare when it comes to mental health. Why, Dr. Webster, is that so important?
Because it's everything that you do, it's everything that you eat, it's everything, it's the way you take care of yourself, it's how you view stress, it's how you connect with your medical doctor, it's what testing can be done to help get to the root of it. Depression sometimes is a symptom of something greater. For some people, they are legitimately born, or I don't want to say legitimately to downplay the experience of people going through situational problems, but there are people who go genetically through an imbalance of brain chemicals, and that can be treated, and that's important, and it can be treated in a lot of ways. And there is a place for what you can do yourself. I want to empower people. I don't want to say that it's your fault if you are suffering from mental health issues, addiction, schizophrenia, bipolar disorders, depression, anxiety, any of that. It's not your fault. There are some well-meaning people, maybe family members, saying, can't you think yourself out of it? Keep your chin up. How can you fight biology? If there is a problem with brain chemicals, so I would like to test. When I'm working with my patients, I want to communicate with their primary healthcare providers and make sure that what I'm doing, supporting them potentially nutritionally or herbally or even homeopathically or from an acupuncture perspective, because there's so many things I can do. I make sure that that doesn't interact because we don't want to make people feel worse. We want to make people feel better.
You know, you bring up so many points there, and one of the things that jumped out at me right away is that people are feeling, and in our society, and often, you know, we contribute to this. We want to numb people because it's really hard to watch people that you love or care about suffer. And so there is a place, as you talked about with biology, where we're going to need pharmacology to help balance
And
hormones
stabilize.
and to stabilize and to keep people safe when we're looking at suicide and to keep people safe. But sometimes as well, we need to validate and listen and be okay with, not always in the world where it's all about looking good and everybody's happy. We don't want people to feel what they're feeling, and therefore we often want to just numb them. Is there a reason sometimes to actually get to the root cause and actually allow people to feel and experience what they're feeling?
You want to go down the rabbit hole, don't you?
I do.
Okay. Just an interesting point about your phone and about phone use. I looked in the research to see, and I don't know why I had trouble finding it, to say that smartphone use was actually potentially a cause of mental health concerns. I think instinctively we know that it has a role to play, but actually there are studies. I couldn't find the studies that I wanted to find on that. What I did find instead was that smartphone use was a sign of depression or anxiety or a mental health concern, which I found was really interesting. So there's that numbing out. When I had a really catastrophic breakup years ago, somebody said something that absolutely floored me, and I didn't understand it at the time. She said, you need to give space to your emotions. And I said some sort of expletives, you know, what does that even mean, kind of thing, like a version of that, because I was upset and I didn't want to feel that way. Part of some of the work that I do with my patients is showing them that it's okay to feel the way that you feel. If your grief, if your anxiety, if your concern, if your depression, if your low mood is situational, those things are okay. It just is, which is a very kind of mindfulness style of being. And that's why I recommend for so many people, you got to do a little bit of meditation or a little bit of mindfulness or whatever resonates with you, whatever works for you, do a little bit of that to just be at home in yourself. This got a little bit crunchy granola, but I'm okay with it because I think these are important conversations to have in a world where we want to just escape our lives.
Right.
I think the situational thing too is the thing that really concerns me, because there is a defined event and then your response to that event, but that there has to be an end somewhere. If that continues to go on, that's a sign that there's something bigger at play.
Because we know about epigenetics, right? How our environment influences our biology. And so how you feel constantly in your environment, if you have a job that's constantly making you stressed and you feel anxious and you're in fight or flight mode all the time, that's going to actually change the way your genes are expressed. That's going to upregulate certain mechanisms in your body that will perpetuate that same cycle. It's a downward spiral for a reason, right? And so sometimes then it does become your state, and we need to break that state, and that's where some therapeutics can come in for sure. But awareness and recognizing, oh, I need help, oh, I need to do this. I think innately sometimes we do know what we need, and we need to honor that.
Yes, and I also think, as you were just saying, epigenetics in our environment, also the environment that we put in our head. That dialogue that we have with ourselves on a daily basis. I'm not good enough, I'm not strong enough, I'm not smart enough. I don't matter, I'm not worthy enough. And so we go inward and we isolate, and that feeds depression and anxiety and mental health, and we retreat. And then it's very difficult for loved ones to know how to actually reach out and to lift up and to help. So I think it's really important to recognize that, the dialogue that we're having in our head, that matters as well, but also the environment that we put ourselves in, the people that we surround ourselves with, the environment that we are working in. All of those things play a role. So what I'm hoping to do in the next segment is to delve in a bit deeper, because we always want to look at also some solutions. We want to educate and empower people, and let's just do this, into action. And I think sometimes we become real passive participants in our health because we're stuck and we simply don't know what to do. So I hope that you'll stick around with us, and when we come back after the break, talk about some practical solutions that we can actually do to move forward to help with our holistic mental health. So you've heard it right here. Stay tuned. We are having a real soulful and deep discussion about mental health. It matters. You matter. So stay tuned. We'll be right back.
Welcome back to Let's Just Do This. I'm Todd Miller, along with Margaret Wallis-Duffy and Dr. Hilary Webster. I think one of the things that stymies most people is they always want to find what's going on, what's happening to me, why is it happening? You mentioned in our first segment about something being situational, which could be work, spousal, could be anything. But there's also, could be something medical that we're completely unable to control. Can you speak to that a little bit?
I'm so glad you asked that, Todd. Thank you. When I was here, when we were talking about thyroid conditions, one of the symptoms of underactive or hypothyroidism is depression. So if you have low mood and you have some of those other symptoms of a thyroid condition, like weight gain and fatigue and hair loss among depression and difficulty moving your bowels, get your thyroid tested and get it tested well. Another really important...
Okay, I'm going to jump in there.
Sure, yeah.
Because I think this is, what does that mean, get it tested well? I certainly know what that means, but
I don't.
Exactly, and I'd like our listeners to understand, because people do want to help themselves, and they do go get it tested, and it's within normal range, and yet they're still not feeling well.
Yep.
So what do you mean tested well?
Yeah, if I had a nickel for every time I had a patient come in where they said, oh, my doctor said my labs are normal. Okay, fine. But I do a full thyroid panel. So I want to see, yes, your TSH, which comes from your brain. I want to see T4, which is the hormone that is secreted from your thyroid gland. And then I want to see T3, which is active thyroid hormone. I've got a ton of patients right now where their T3, their active thyroid hormone, is actually either on the low end of normal or it's just plain old low. Even patients on thyroid medication, and all of those other levels are normal. So just because it's normal doesn't mean it's healthy, and we need to know that. Yeah.
And the good news to that story is there are things we can do to help support that low value, which is actually going to translate to people feeling better. Imagine that.
Who knew? But yeah, and some of the herbs that we use to kick that conversion from T4 to T3 into high gear, withania being one of them, has actually been studied in anxiety as well. So go figure. So these are herbs that are protective to our stress systems, thyroid, and our mental health as well. Another thing that you need to make sure is get your hormones tested. I do a ton of really, really detailed urine-based hormone testing in my office, because maybe if your depression or your anxiety comes with a cycle, maybe it's PMS, and that can be very serious too. They call it PMDD, which actually is full-blown, pretty serious depression that's correlated with your cycle if you are a woman. Also, testosterone deficiency for the fellas can look like depression as well.
Yeah, and this is what's so important, and what I love about the way you practice and why. I mean, we're lucky to have her at Wallis for Wellness, as well as our other naturopathic doctor, Dr. Resendez, is because you do care to test and not treat blindly. And this is where this whole Better Together movement of conventional and complementary medicine working together, we're not hugging a tree and howling at the moon and guessing. We're really looking at the science. So let's speak to some of the actual things people can be doing in their day-to-day life, in their lifestyle, where they can feel like they're having control and contributing to better mental health.
Yes, because I'm glad you talked about lifestyle, Margaret, because there's herbs we can use to lift your mood, and there's nutrients that we definitely can use, and we can use those in a very pharmacological way. We have the studies to back that up, but it's not just what you take, it's what you do. And there's research on that. One of the biggest things is exercise. So we know time and time again that aerobic exercise, yes, it gets the endorphins going, and we have that research based in studies that show that it is one of the most effective solutions for mild to moderate depression. Exercise, aerobic exercise, and sometimes it's just getting out and walking. It's just moving your body, and sometimes it's high intensity exercise, or wherever you are along that way, just start moving your body around, and your body will thank you and your mind will thank you.
I want to get real here, because I agree with you, and I know myself, and I've never suffered with serious depression, but I will be the first to admit that I have periods, you're smiling because you're my naturopath, periods of anxiety where I can feel completely overwhelmed and then stuck. So when you're feeling that way, it's sometimes almost impossible at the thought of even leaving. Some people can't leave their house.
Can't get even out of bed in the morning.
Thank you. So I think it's really important to get real when we're talking about this, and at least encourage people one step literally at a time. If it means today you can only get out of bed and then get back in, but tomorrow you get out of bed and you walk to your bedroom door, and then the next day you're doing a little bit more. I know this sounds so simple, but for those of you that are at home that are seriously suffering, this is real.
Yes.
Correct?
Yes.
It's not as easy as just saying,
No, and we're not
move your
pandering
body.
to anyone or trying to make anyone feel bad, but this is reality. If you can make that step, you are showing progress, and you're saying, I matter, I'm going to put one foot in front of the other.
Right.
Thank you, Todd, for saying things like I matter, and I noticed you earlier mentioning saying, feeling good enough and feeling like you're enough and taking up space. One of the best ways, I think, to kind of start yourself along the journey to incorporating physical activity into your life is to, and sometimes it takes a little bit of what they might call massive action, is to join something. I know people, I'm a big CrossFitter, that's one of my passions, and I know people in the CrossFit community who would not be here if it weren't for CrossFit, because we would have lost them to suicide because they were undergoing major depression. And I myself, I have a story, to do with that as well. I think my chances of being here were greatly increased because because of CrossFit, because I went through a really difficult time, and I walked myself into a CrossFit gym and I said, I surrender myself to you. I am here and I want to come work out. And I've been doing CrossFit for 5 years now, and I coach it. And the people that I have met, And that's the thing too, that keeps you accountable, that keeps you going there when you don't want to. Because there's lots of times that you don't feel like exercising. So you'll have to mind ninja yourself into going. You have to trick yourself into being there.
Yes.
Well, and I think you're absolutely right. The sense of community is so important. And I think in a world where we are so connected, we are yet so disconnected and so distant and so isolated. And that's what, my hope in this big, audacious goal that I have of Better Together, as we're trying to get the funding to get an online community and a website where people can feel like they have someone they can reach out to, and whether it's be accountable or just simply say, I'm really struggling to even get out of bed today. How can we help? Maybe it's just going for a walk with that person, or maybe it's going to their house to just connect and have a discussion so that they feel better.
Make sure they're eating and drinking and just have the presence of someone near them to say, I'm here with you. You matter.
Absolutely. So thank you for bringing up the sense of community. And for you, it's CrossFit. For someone else, maybe it's our Better Together community. Maybe it's your church. Maybe it's your, whatever it may be, I want people to feel a sense of community. What about nutrition? What are some things right here, right now? Mood and food go hand in hand. What can we do?
As a naturopathic doctor, I know it's cliche to say avoiding gluten and dairy is good for your health, but I have some reasons for which this is a really important thing to avoid. So wheat products and dairy products, we just don't digest them the way we used to, and we could do a whole podcast on why that's the case. But when you don't digest those little products, some of the breakdown products of the proteins, the protein gliadin and the protein casein, actually go up into your brain. They become casomorphin and gliadorphin, and they affect our brain. When patients remove gluten and dairy from their diet, their mood stabilizes. They often report feeling less anxious. Sometimes it's really difficult to cook for yourself, and that's why I work so hard with my patients to find solutions, to find realistic solutions, to find easy solutions. I often will try to dig deep and figure out, how can I help make this easier, make this transition easier for your life, because everybody's at different stages. And like Todd said, sometimes it's an issue just to eat enough. If you're suffering from a mental illness, getting proper nutrition is a huge challenge.
And, bread is one of my comfort foods, and I eat a lot of it. And now I'm thinking, okay, maybe this is playing into my moods.
Right. So I'm paying attention and listening to our bodies. I think that's something, and having somebody that you can bounce that off of is really, really important. This is how I'm feeling, and making some of those correlations. I think sometimes when we're in something, we can't always see the connections, and that's what having a good integrative healthcare team can do. A naturopath, an MD, a counselor. Let's talk because we've got so much to cover in so little time. Counseling, how important is that to be able to talk about our feelings?
I wish it was part of our publicly funded health system.
Yeah.
I really do.
Amen.
Because the amount of people where I'm a pair of ears for them, but that's not my zone of genius. It's not my expertise. It's not my training. I can certainly provide a therapeutic space for someone to express their concerns, but different people I've worked with, when I've gone through, some rough patches, they all give me different tools. A good therapist should be listening to you and giving you tools to help self-regulate, to help you be able to heal yourself is a strong term, but give you something to ground yourself. And different tools work for different people, and you got to find someone who you work really well with. And sometimes that's a journey, but I would say please persevere. Seek out whoever that person is, even if it's a psychiatrist, if it's a counselor, if it's a psychotherapist, if it's a psychologist. I don't really care who this person is. If you have a good therapeutic relationship with them, tell your naturopath or tell your primary healthcare provider and stick with them. They're going to help you get better.
Yep.
Okay, we've only got a couple of minutes left, so I want to hit two things very quickly. In terms of vitamins and minerals that can support, and then lastly, and this is very seriously, if you're listening in or watching at home, we also want to talk about not coming off medications without support. So we've only got a couple of minutes, so let's first talk about some minerals and vitamins, and then we'll address the other issue.
Quickly, yeah. So some B12 deficiency is associated with anxiety and depression. Also, vitamin D deficiency. Test these things before you just replete them, and do it with the guidance of a naturopathic doctor or another professional who's well versed in this. What I often tell my patients, even if you're outside, you're not there naked out in the sun. Your sun exposure is still limited in the summer. You still need to supplement vitamin D, but because it's a fat-soluble vitamin, please make sure that you do so judiciously and with an expert or with a healthcare provider. As far as medications, please just don't come off them. Some antidepressants have some really nasty negative rebound effects if you just come off them. Work with your medical doctor to safely taper if that is within your goals, and both of you agree on that. It's not my job to help people come off their medication or to tell them to come off their medication. In a perfect world, you're healthy enough that you don't need them.
Yep.
Absolutely. We just, skimmed the surface of this discussion. However, I'm so proud of the discussions we're starting to have. And I look so forward to having you back, along with other professionals, to have panels to really delve in to what it truly means to have an integrative, preventative approach to mental health. Thank you so much for joining us. If you are struggling at home and you need help, please go to a crisis line or reach out to someone you know. See your medical doctor. Follow us and stay tuned, because you have our what's the word I'm looking for? We are committed to making sure we do something to help with mental health in this country. And we are going to be better together. You are not alone. So on behalf of Todd Miller, myself, Dr. Webster, and the entire team at Your TV, thank you for joining in and on this very important discussion on mental health, and we'll be having more of it. Until next time, be well.